Hello, hi, welcome everyone. I think we can start now. We waited for a couple of minutes for other to join. So, welcome everyone to today's session. So, this is Dr. Rafi, and with me, Dr. Yusha will be also conducting the session. So, yeah, so before we start, there's this disclaimer. So here we'll be just talking about the exam strategy and publicly available resources by MCC. No actual NAC examination station cases or any examination questions will be shared here, or we won't discuss any exam related or confidential content. So we'll just go through the strategies or the general clinical knowledge that we had and the strategies that we followed during our preparation here today. So before we start, we'd like to introduce ourselves. So I'm Dr. Riazul Rafi. So I cleared both my MCC QE1 and NAC OSCE exam, and along with the exam, I also have Canadian experience in working in clinical settings. So I've been working in general internal medicine in a tertiary setting in Canada under Alberta Health Services. So here today we'll be sharing our strategy structure and practical approach that helped us getting good score in NAC OSCE. So I would like Dr. Yusha to share her. Yeah.
Hi guys, I'm Dr. Saida Yusha. You could call me. Most people here call me Saida. So I'm an IMG, and I've also given my QE1 last year, and I just gave my NAC in May. I'm currently working at another tertiary hospital here in Alberta, in AHS in general internal medicine. So that's about it about me. For both like my exams, I managed to, by God's grace, manage to get superior scores. Especially the one like we are going to talk about today, the NAC OSCE, where I managed to somehow get like a pretty high score, and we are going to be sharing how we prepared for this exam, hopefully help anyone who's preparing for the upcoming NAC exam or maybe even next year. Hope we are of some kind of help.
Both me and Saida prepared together for the NAC OSCE, and so when you started, we are also overwhelmed for this journey. Like we had a lot of doubts in our mind where we didn't know like where to start from. But what we like to do is to have a strategy or to have a structure before we go about any exam. So I also studied with her for the Q1. So we like to have a strategy and plan. So for NAC OSCE, when you started, so we felt like there are a lot of resources for NAC OSCE, but nothing's like a structural one which you can solely follow. So if you ask anyone what to follow, they'll give you different resources. So it gets difficult to have a fixed structure like which you will follow throughout your journey. So whenever you are doing the histories or examination, then you're like going back and forth to different resources, so it gets difficult sometimes. So what we did, we tried to go through different resources and try to have one of our own strategy or framework for history, examination, and counseling, and we made notes of those as well, and I think that really helped us in our journey. And I think in Saida's part, she can also share her experience. But I think to do good in this kind of exams, you need to know like what you are going to revise like through and through, and throughout your journey, like which specific plan you're going to follow. I think that helps all the time. So in this like session, we'll show you what are the things you should do and what we followed. So we'll discuss everything extensively. So before we go about our strategies and how should we go about the exams and histories, I want to discuss about the NAC format. I think so far you guys are aware of it. So for NAC OSCE, you will have 12 OSCE stations, and out of 12, the 10 station will be scored, and there will be 2 pilot station. I think you guys are already aware of it, right?
Yeah.
Yeah. So and between these 12 station, you guys will have like 2 to 3 wait station with no clinical task, and those won't be scored. But out of 12 station, it's really difficult to know which one are the pilots. So we'll have to take all the 12 station. We'll have to give importance to all of them like equally, because we don't know, right? And no one can tell you like, oh, these were like pilot, or these were like scored station, because we are not allowed to share information after the exam, or no one knows. So 12 station, and every station is like 11 minutes. So out of 11 minutes, there can be some post encounter session as well. So we'll discuss about it in coming slides, and you'll get 2 minutes between each station. So before entering a room, you'll get 2 minutes just to read the prompts and to move on to the next station. And when you enter into the room, so there are like standardized participants, and you'll find a physician examiner. So sometimes you can also find only the physician examiner who can act as a standardized participant as well. But usually you'll find two people. So one is the standardized participant will act as a dummy patient, and another is the examiner. And so before going into the room, you'll be asked to do some task. So it will be written. So we call it door sign. So for example, they can ask you to take history, or they can ask you to do an exam. So we'll talk about all of these in like extensive manner. So now if we come to the type of station, I think already all of you are aware of it. So you can have history stations, only history. So they'll ask you to take history, and then you'll explore the differentials and relevant background. And sometime with history, they can ask you to present those cases as well. And after history, you can have history and physical examination station, where you'll take history for a couple of minutes, then you'll do the physical exam. For dividing the time, or like how they will ask you to like take history and physical exam, we'll discuss about it in the next slide. So I'm just giving you the type of station here. So you can have physical exams only as well. So they'll ask you to do a physical exam, and after that you'll have to describe that physical exam. And sometime after history, there can be counseling. There can be only counseling station, like ethical ones, like breaking the bad news, or just have a like uncommon type of station as well. And there can be data interpretation plus management station as well sometimes. So they can give you a picture, they can give you some clinical data, and they'll ask you about the management. So these are the basic type of station that you have. And I'll go to the next slide now. So here about the time management. So as I've discussed about different type of station, so here for every station, the total allotted time is 11 minutes. And out of 11 minutes, you'll get 8 minutes for doing the task in most of the station. And after that, 3 minutes can be for examiner to ask you questions, which we call the post encounter. And sometimes there will be station where you'll be just doing the whole station in 11 minutes. There won't be any question. So for example, it can be a history and physical examination station, where they'll just ask you to take a history and do a physical examination, and it can be 11 minutes. Sometime within 8 minutes, they will ask you to do a history and physical examination. So in these kind of cases, it's bit compact, like you'll have to be very careful about your time. And sometime they can ask you to do a counseling for like 8 minutes, then there can be some question. Sometime you might need to do the counseling in a whole 11 minutes. So these are the basic kind of examination time management and structures. So for a good structure, if you have a good structure, that's going to save your time and improve your performance as well. Because what happens when you have stations like history and examination, where you need to complete it within 8 minutes, it gets really difficult if you don't like have a good practice of time, or like you have a good practice of tracking your time. So but the good thing is you'll have a clock for tracking your time inside of the room. So the best practice is whenever you are going in, you look at the clock and you can see like where's the time, and you can start counting from that. So if you are having a 8-minute station, so what you can do, you can look at the clock and do 4 minutes for the history and remaining 4 minutes for the physical exam. So that's a like a good habit to do. But and what you can do when you are practicing at home, you can have a clock right beside you, so that you can practice in the exam environment. Yeah. And another thing is like when you have 8 minutes to do both history and physical exam, don't waste a lot of time doing the history. Take your time, keep your time for your physical exam as well. So you can divide like 4 minutes for your history and 4 minutes for your physical exam. So far, if is it anyone having any question? Hello. Can you guys hear me?
Yes, doctor.
Yeah, so
Yes,
you guys
you.
have any question about any specific thing so far? Otherwise, I'll just proceed to the next slide.
That sounds good. Thanks.
Okay, and now it comes to the scoring. So for scoring, they will score from 500 to 700. So they will score 10 station, and it's from the MCC website, and the year they started this new scoring pattern. So the pass score from that year is 577, and for a mean 600 is the mean, and if you get anything above 600, if you're getting 625, 25 is the standard deviation, so 625 is the one standard deviation. Yeah. And here we got this annual report from NAC from the MCC website, and it shows like from which specialty how many questions you will get. So this is very important to know before you're preparing, because it gives you a guideline in which specific area you need to focus on. So if you see here, so in from medicine it's very high yield, so you'll get they have recommended almost 2 to 4 station from medicine. Then again from surgery you'll get 2 to station. And here if you see, psychiatry is very important. Like in Q1 it was also very heavy in psych. So for NAC OSCE, psych is also very, very important. So you will get like 1 to 2 cases. So that's recommended. And also from obgyn, like you might get 1 to 2 pediatrics, and adult medicine or geriatric 1 to 2, and emergency or urgent care you'll get 1 cases. So that's the recommendation. And if you come to the system wise, so for RESP, you'll get 1 or more than 1 cases, cardiovascular 1 or more than 1, gastro. So what I think, like these 3 system is very, very high yield, and if you go through all the cases and all the possible cases, you'll get a good amount of cases, or the familiar cases for sure, because these systems doesn't have a like lot of question like cases, right? So this is a good way to see like which one you should focus more. And if you come to musculoskeletal, genitourinary, and endocrine and neuro, so combine this 4 system has like 2 to 3 cases. So yeah, you'll have to prepare everything, or you'll have to complete all the system to get a good score. But if you see like resp, cardio, and gastro, these are very, very high yield. And if I come to the physical examination part, you'll see they'll give you physical only, like whole exam case will be on physical examination. There will be 1 station like that, and then you'll have combined history and physical, so it's 2 to 3, right? So if you combine 1 and here 2 to 3, you'll get almost like 4 station where you'll do physical examination. And these 3 system, rest, cardio, and gastro, these are super, super important. So if you're doing the physical exams, like if you know the physical exams from this system very well, then you have a high chance that you'll get this in your exam. Because if you see from data from here, so this has good chances of coming. But again, it depends every year. And from another system is musculoskeletal, is very important for examination as well. So basically these are very important. And if you see this N1 report, and this is also available in MCC website, so you'll get a very good idea about like what to, like which system is like high yield and which one you should focus more. And as you all know, like the disciplines we'll be covering is medicine, we'll be covering surgery, psych, obgyn, pediatrics, geriatrics, and urgent care. So what do they want? Like what are their expectation? So if you go to the MCC side, and you'll see like their expectation is from you to be a safe doctor. They want you to be a safe entry-level resident who will be like careful about their patient and do no harm. So for NAC OSCE, this is what they're expecting from us. We'll have to, in our approach and in our way of ruling out the differentials, we'll have to make sure we are not missing out anything which is important. If you are missing out key points and that can put the patient's life in danger, you're going to lose a lot of score. So this is very, very important. So this is whenever you are preparing, you are approaching one case, you should remember like, oh, if I'm missing any key point, if I'm missing anything, any urgent or emergency thing that can cause patient's life. So this is one of the approach while preparing. So that will help you get good score. So for every cases, you need to have a good case framework. So before you approach any case, so the patient will be presenting with symptoms, right? So for example, for NAC OSCE, major presentations can be chest pain, shortness of breath, fainting, jaundice. These are for example, these are very common presentation, right, in day-to-day life. So you have to make sure you have good differentials in your mind before thinking about anything. So for example, if a patient's coming with chest pain, the first thing you'll have to think before entering the room is the differentials. And then another thing is like, what are the key question about this symptom I can ask? So these are two things. When you are preparing a case, for example, you are studying chest pain, you need to be very thorough about the differential diagnosis. In the later part of this session, we'll be discussing more about the differentials. But here, I just want you guys to know like differential diagnosis is the key when it comes to NAC OSCE, because all the questions you're going to ask in your history will come from your differentials. And when you're choosing your differentials, you have to think about the life-threatening or something that can kill your patient first, and then you'll have to think about others as well. So you'll have to ask all the questions around those differentials, and then the key questions related to those cases. And after this, important is like if they're asking you to do an examination with that station. So if patient coming with chest pain and they're asking you to do a focused exam, so then you'll have to think, oh, it's chest pain. Then from history, you'll have to think, oh, in which system I'm going to examine. So for example, patients coming with chest pain, cardiovascular, and also resp is very important, right? But sometimes chest pain can be from GI causes, right? So then you will have to think, oh, do I need to do a GI examination? Because sometimes a patient can show like upper abdominal pain as chest pain. You are reading the patients presenting with chest pain. When you go in, you get to know the pain is more in the upper abdomen. So then you'll have to think, okay, so my focused exam will be an abdominal exam as well. And depending on the history, you'll do the necessary examination. So it's very important to have an idea in back of your mind before going in what examination you'll do. And your history and your questions will guide you like which system specific exam you need to do. And we need to be careful about the danger sign as well. For example, if someone's coming with chest pain or shortness of breath, there are questions like you'll have to ask about dizziness. Then you'll have to ask about heart racing or palpitation. You'll have to ask about if the patient is having any cough. So these are questions you'll have to ask to rule out the closest differentials and to have a guide in which way you'll be moving forward. And for the management part, so this is for the post encounter actually. So when they'll be asking about the management, you'll have to know like which test you'll have to order first. For example, patient coming with chest pain and the diagnosis is top differential is the acute coronary syndrome. So if you're saying I'll do a complete blood count, that's the wrong answer, right? So you'll have to like prioritize your test as well. You'll have to make sure that you're saying I'll do a cardiac enzyme and I'll do an ECG first. Then you can tell all about the basal metabolic panel and other investigation. So it's very important to have a like order in your head, in which order you're going to answer, and you should put the important one in your top list. And after that, in some cases they'll be asking you about the treatment plan here as well. So if for example, if a patient's coming to you with the chest pain, and from your history it's an acute condition, the patient's going through a cardiac event, so your initial treatment plan will be to resuscitate the patient first. So you'll have to mention if you see from the vitals, the patient vitals are poor and the patient's hemodynamically unstable, so you'll have to mention that I want to resuscitate the patient first, then I'll do all these ACS management like MONA, morphine, oxygen, nitrates, like this. So you'll have to know like which initial treatment you need to mention. For example, someone's coming with acute condition and you are telling the management about the chronic condition, so that will cost you marks. So you'll have to be very thorough about that. So there is a like keyword here, so strong communication. So strong communication can make a lot of difference in your station. So when you're practicing, and that will come from practice, so you'll have to keep on practicing, and that will grow your communication better. And that's the only way you can get your communication skill in a better shape. So this is the most asked question, like which resources you would recommend. So there is no single resource that I can recommend, but for history taking, we have seen one book that is like really good. So that is the Edmonton Manual, and this is a really nice book. It has history taking, important points for history taking. It has very good differentials. So and it also mentions risk factors for different cases, good associated symptoms as well, and for social history and other history, it's really good. So if you want to follow one book, then it's Edmonton Manual. So it's good for history. For examination, it's also helpful sometimes. Then there are other PDF circulating around. So they have NAC comprehensive book, which is also good, and they have NAC attack by Dr. Humaira. That's a PDF that is also good for differentials and questions to ask. But again, you won't find in one single book where you'll find all the everything organized in a structural way. So what we did, during our preparation, because we felt one single book wasn't enough, so we went through different books. We tried to accumulate information in one note for history, and we followed that note throughout our journey. And for a physical exam, so for physical exam, Geeky Medics is good, but it's better for the UK, because I think it's UK based, so they have good techniques for learning, but to sharpening and to follow the Canadian guidelines, you can see Edmonton Manual alongside, because sometimes the like serial of doing examination is a bit different in Canada. So that helps. For example, while doing the abdominal examination, here after inspection they do auscultation, but back home we used to do first inspection, then palpation, percussion, and auscultation. So that I found a bit different, and from the Geeky Medics it's also a bit different. And you can search YouTube as well. It has good amount of videos, but again, for this examination part, we struggled when it came to verbalizing things, because in NAC OSCE, when you're doing the exam, you'll also verbalize what you are doing, what you are looking for. So sometimes these videos, they don't have this in a very good organized manner. So we also try to organize that thing. We try to make a couple of notes on that as well. And when you are verbalizing, if there is any like positive finding, you'll have to mention that as well. and the examiner, the physician examiner who's sitting in the room, if there is any positive finding in the patient, they'll also mention it to you. So when we'll discuss further on physical exam, we'll give you all the ideas on that as well. And the last thing is counseling. So when we're doing searching for counseling resources, I think there is no single place where you'll find good counseling format or resources. And we found some in Geeky Medics, but again, it's not that structured. So for counseling, what we had to do, we had to go through different books, and we made a our own format of counseling and the key question that we shouldn't miss. So that was really difficult to find and compile. So counseling is one of the thing that is very frequently tested, because from the NAC annual report, what we saw, there are good amount of counseling as well. And sometimes they can ask you to do a counseling in a normal history station as well. So it's very, very important to have a good hold of counseling and at least the key points for counseling. So I think that's helpful if you want to score better in your NAC OSCE. So far, I think we have discussed a couple of things. So if you guys have any question, I would like to answer here before I proceed, or otherwise I'll go further.
I wanted to know, how frequently did you practice, prior to your exams, and how many study partners is good for us?
Yeah, so I'll come there. We have designated slide, because I know whoever is preparing, they have this question in their mind. So we'll discuss extensively on that as well. But if you have any question regarding
I have one question.
Yeah, sure.
You mentioned the Edmonton manual. Do you recommend a particular edition?
So what we did, we practiced from the 6th edition. I think I found that good enough. So I think you can find that PDF online as well. So I think that is good enough to practice, and that is all the key information. I don't think you need the latest one, and I don't even know if they have the latest edition or not. But the 6th edition that's circulating online, that is good enough. Or sometimes some people often prefer hard copies, so they buy it from the libraries or shops. So you can also, if you are comfortable with the hard copies, you can use that one. But I think that's a really, really good book. So if you want to get familiarized with the history for different cases, so I think that's an amazing book. Yeah.
Thank you.
Yeah. And so this slide is focusing mainly what we did during our preparation. So for history taking, we try to create one consistent history taking pattern. For example, you will encounter different cases, right? So if you are having different kind of history taking pattern, that becomes confusing, and that also it's difficult to remember for which case how you prepared. So it's very important to come to a consistent history taking pattern, so that you don't need to switch between different books or resources, and that will save a lot of time during your preparation. And we practice those same structured over and over again. So when you stick to a pattern or framework, and you keep on practicing the same, so that helps you to improve your flow. You get better on your timing as well, and that boosts your confidence as well. So what I felt during the preparation, is very important to stick to one method or one framework, rather switching around books. So that is very important. And it's very important while taking the history is pay attention to Canadian exam expectation. What I've already mentioned, they want you to be a safe doctor, so they don't want you to miss the key differentials, for example, that can cost a patient's life, right? So you'll have to be very careful on that. And also the key question to rule out the most important causes. So you'll have to be very thorough about, and you need to keep in back of your mind about those key points you're going to ask in different cases. So this is important for history. And if I'm coming to counseling, so for counseling as well, so as English is not our first language for most of us, and we need to think in our native language before we translate into English. So counseling is something that you need to practice a lot. because the more you practice, you'll be more fluent, and those words or those phrases will be in back of your mind. So when they'll throw an unusual like station or something that you haven't prepared, but if you have a format for your counseling, so that's going to help for sure. So it's important to have a counseling framework with key points for common topics. And then you'll have to, there are like different counseling stations, right? So sometimes it can be breaking the bad, so you have to know about the spikes and other formats as well. So which in our other session we'll discuss more about those. And coming to the physical exam, so you can see a lot of videos from YouTube, but again, it's how you practice with your partners and study group. And again, it's very important to have structured verbalized words prepared. So when you are practicing, if you have a structured verbalization, it gets easy for you to describe what you are seeing and what you are looking, right? So what's the finding there. But if you are not like verbalizing it, it gets difficult. And when you're going into the exam with less practice on verbalization, you need to think, and then it kills a lot of your time. So it's very important to verbalize and have a like standard format of verbalization, so that you're like creating a good impression when you are doing the examination. And it's very important to have a consistent narration style as well during practice, and that will come from following a like fixed or structural verbalization format. If you can make a note. So what we did, we made note on those like a lot of different notes on different physical exam as well. And coming to the post encounter part, so if you like see the ratio from the website, you'll feel like the post encounter is almost like 25 to 30% of the exam. So in some station you can get post encounter. What when I was showing the NAC annual report, so from there you'll see they'll just ask post encounter in a couple of stations. Not all of the station will have post encounter, but again, it will carry good amount of marks. And for your management part, you need to know like how to go about your managements. If it's a acute condition, you need to focus on your resuscitating the patient first, then talking about the individual management plans. But yeah, post encounter, you'll have to be strategic as well to get good marks in this. And after this, someone was asking, I think Fatima was asking about importance of having a study group. So the NAC OSCE exam is a practice-based exam. So the most important thing here is practice. So you'll have to practice a lot to get good score. You can have a very good knowledge. You may know everything, but if you are not practicing enough, you won't get the good outcome. And if you're not practicing enough, so when you have the real exam, you need to think when you are doing those maneuvers or you are asking those questions. But the fluency, the flow comes from practice, so it's very important. So again, the importance of study group is immense here. So what I think the study group should consist 3%. That's the best idea. You can go up to 4, but not more than that. It shouldn't be too big, it shouldn't be too small. So a mix of 3 or 4 individual is good. So and another key is like practice every day. Like even if you're practicing 30 minutes a day, that's good enough, but practice every day to keep your flow and consistency. And what I would suggest here, that set a monthly target. If you're finishing 2 cases a day, in a month you'll be easily finishing like 60 cases. In 2 months time, you'll finish like 100 cases, right? Even if you're like finishing 50 cases a month. So there's a lot. And yeah, that will make you a pro by the time you appear in the exam. But consistency is key. I know it's difficult. Some of you are working, some of you are having kids, so it's difficult to get time. But if you are organizing a study group, it can be virtual, it can be in person. In person is difficult, but you can keep it virtual as well. You can practice in a virtual meeting. but it should be regular. And the importance of having a 3-person group is if 2 people are practicing, one is acting as a candidate and another is as an examiner, so the third person can say like what are the things they are missing, so they can get some review from the third person. So in that way you guys will be benefited. And then again, what you can do to divide the practice days. Some days you can do history taking cases, someday you can do counseling, and someday you can mix with history and physical exam. Some days can be for post encounter. It's again depends on individuals and what you can decide as a group. So some people just finish the history taking cases first, then they go to counseling, or you can mix and match. So whatever works good for you. And coming to the counseling station, so it's also very important. So you'll have to keep on practicing your counseling station on a regular basis. And physical exam, I've already mentioned, you need to have a good structure, good verbalization. And the thing is like once in a while what you can do, you can practice with a different group or like another individual. So what that will help is to know more, like if you're practicing with a different person, you can share or exchange knowledge, and that comes handy, because sometimes you might not know something that other person do, or sometimes the other person is doing a different course and you're taking a different course, so you can share some information. So that always helps. So that's another good idea. And sometimes there are standard courses out there, you can do that. You can follow if someone having good resources or good framework, that comes handy as well. And the main point is like a good group keeps you consistent. Even if you're not very consistent, if you are studying with a group, you'll feel the urge to show up because other people are preparing, so there is a pressure from there, and I think there's a healthy pressure. And that helps you organize your cases more, that makes you ready for the exam. So I think for this exam, study group is a must. There is I know people who practice themselves, and even if they knew a lot, but they end up getting poor score. So, and this exam, if you are passing, so hardly anyone is, because I think you can only appear 3 times. So for this exam, you'll have to be very prepared before you sit for the real exam. So having a study group is a must. So it's non-compromisable. So I'll go to the next slide. So this is for all the candidates now. Once I was in your shoe, and what I felt like asking question is very important, because it's very normal to get confused during preparation. You'll have a lot of questions, but never self-assume anything, any clinical information. If you're struggling with something, if you're confused about it, or if you're confused about a proper way of doing that examination, discuss with someone, ask from whoever taken the exam, ask from whoever running a course. So always ask question, never self-assume. No question is stupid. Like if you're asking question, other people also learn. So it's very, very important. So always verify the information for counseling or for examination or for history. If you're confused about anything, always ask. So we have our Telegram group. If you're encountering any question, try to put your questions there. We'll try to get back to you guys as soon as possible.